Hello, this is Janet Michael. In addition to hosting The Valley Today each weekday at noon on the River 95.3, I also produce podcasts, and I'm excited to introduce you to a new podcast series in partnership with Lord Fairfax Community College. Having provided higher education and career training for the past half-century, LFCC is tightly interwoven into the fabric of the Northern Shenandoah Valley and Piedmont regions. Join me every week for conversations with current and former students to hear their funny and inspiring stories as we learn about their journey to higher education, the role that LFCC has played, where they are now, and where they plan to go. We'll also talk to current and former professors about their experiences and best memories of LFCC over the past 50 years. Get every single episode as they're released on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcast, Google Podcast, on Spotify, Amazon Music, wherever you listen to podcasts. Just search for LFCC Stories. Hello and welcome to The Valley Today. I am your host, Janet Michael. Happy Friday as you are listening to the show today. And if you were listening to the show yesterday, you will know that it was our Community Health Partnership Day. I spoke with Laura Walls and Tiffany Markwood from Valley Health and said at the end of that show that I was going to talk to Dr. Feit on the 28th, but you know what? I moved some things around. So we are on the Zoom screen today with Dr. Feit. He is the Vice President of Population Health. He has been a regular guest on the show since the beginning of the pandemic. And Dr. Feit, I was glad that you could work your schedule around so that we could chat today, because I understand Valley Health got their first batch of vaccines this week.
Absolutely. Yeah. Thank you so much for having me back. We are incredibly excited. We received our vaccine first shipment. Gosh, it was yesterday morning. Seems like a long time ago. We received it yesterday morning, and we had vaccine clinics open and vaccinating our frontline healthcare workers yesterday afternoon at all 4 of our Virginia hospitals. With the snow today, we're going to have a little bit of a delay, and we'll start in our West Virginia hospitals tomorrow. But yeah, our Virginia hospitals continue to vaccinate today, and we couldn't be more happy.
Now, did you know in advance how many vaccines were coming and when they were going to be here? Or was it kind of, okay, you've got an hour, get ready sort of thing?
We've been planning for months. So on the broader level, we've been planning. This is a kind of technical vaccine to handle given the deep freezer needs and all the different handling issues around the Pfizer vaccine specifically. And so our team has been practicing and drilling and watching videos and dry running and getting ready. And the pharmacy team has been brilliant. Our logistics team. So we knew it would be on our loading dock yesterday morning. They come in pallets, little personal pizza-sized boxes, which each have 975 vaccines in them. And so we knew we'd be getting 3 of those. And at least we've known that for a few days. And and so now we're in the process of setting up these clinics and getting folks vaccinated. And we're really excited about that.
And I know frontline workers are, as they should be, first in line. How do you determine who's an actual frontline worker at Valley Health?
Yeah, so it's been a little difficult actually. I mean, we have a saying here at Valley Health that we're all caregivers, and beyond that, we've asked folks to really be prepared to play whatever role they need to play as the pandemic gets harder and our volumes are up. And I'm always thinking about our nurses and our doctors who are doing this work every day. And in the middle of my giddiness that we now have a vaccine and we're starting to give it out. We've got over 100 inpatients right now with coronavirus. Our ICU is busy. Our ED is busy. Our hospital is full. We're busy, and people are taking care of really sick people. So first and foremost, I want to give my thanks always to them first and to remember the work they're doing. We did a couple of things. Certain things are obvious. So the ICU, the high intensity respiratory unit, the ED, our respiratory clinics, people taking care of COVID patients every day. We knew they'd be in that first group. It's once you get past that group that things get a little dicier. And then what we started to do we created tiers, and we tried to create the tiers qualitatively by the kind of exposures people have, how often they're facing the public. The definition that we were given was people who are caring for COVID patients or caring for patients who may or may not have COVID, unknown status. And so we worked through a tiering process of understanding people's roles. And, once we started, and then we started looking at the acceptance rate. So, when you get X number of doses, the number of people you can offer them to depends on whether 90% of those people are going to take it or 50% of those people are going to take it. And so that was the other variable, is understanding our likely first round acceptance rate, and then trying to be as agile as we can about broadening the circle to more members of the medical staff. And our goal, as soon as we know more about our supply for next week, is to extend it beyond to healthcare workers beyond Valley Health. And our goal is to get all the healthcare workers vaccinated as quickly as we can.
And I know this Pfizer vaccine, you have to take in 2 doses. Are those doses identical? Is what you got in this, is it just the first dose and another one will come as the second? How do you have to allocate those first and second doses when you're giving them out?
It's exactly identical, but they've held back the second doses for us. So 3 weeks, plus or minus 2 days on either side. So 19 to 23 days.
Wow. So you didn't have to automatically say, okay, whatever we got, we have to cut in half because this is got to be done a second time to somebody else.
Yes, ma'am.
And you mentioned, so you're getting more next week. Do you guys have any idea how many in total you're going to get between now and when?
So we're hopeful to get more next week, but there's a fair amount of uncertainty about next week because the Moderna approval is this week. So if the second vaccine gets approved, that creates more opportunity to get more vaccine. In addition to a second shipment, there's more variables next week. There's a second shipment potential for Pfizer, some of which may go to this partnership between the commercial pharmacies and the skilled nursing environment. There's also the health departments and whether they do any distributing to first responder groups. There's just a little more uncertainty about how they're going to manage this next shipment. And then whether there's another shipment of the other vaccine coming around the same time. So we don't have details for next week yet.
And both of these vaccines are pretty close in their efficacy for how they're going to work, right?
Yeah, I've spent a lot of time reading over the details of the Pfizer vaccine. Truth be told, I got the submission for the Moderna, what they sent into the FDA like yesterday, and I haven't had a chance to read it yet. So, but my understanding is they're both, 94, 95% effective.
And the Moderna vaccine, from what I gather, doesn't need the cold storage it needs to be kept cold, but in a standard freezer, not to the degree of the Pfizer. Did you guys have to build or make or buy cold storage to be able to store the vaccines?
We chose to buy it. We thought that making it ourselves probably wasn't the way to go. So yeah, we added to our capacity of deep freezers. Minus 70 degrees is cold.
What in the world are you going to do with them after this? I mean, this is going to be one of those one-off things, won't it? Or can you just not keep them that cold and use them as regular freezers in the future?
Really, really cold beer. Yeah, I don't know. That's tomorrow's problem.
I love that idea. So when do you expect or hope to have all of your frontline workers vaccinated? Are you thinking by the end of December, potentially into January?
I think it's fair to say by the end of the year. It is our hope. And it's a hope. We don't have all the details yet of all those shipments. But my hope would be that the healthcare workers in the community would get offered a vaccine by the end of the year.
And I know you're vice president of population health for all of Valley Health. And I think it's important to point out that we're not just talking about Winchester Medical Center here. I mean, there's Warren Memorial, there's Page, there's Shenandoah. You mentioned the 2 in West Virginia. You also then internally had to get these vaccines to those other locations as well, and then get them vaccinated into those frontline workers.
Absolutely. So the distribution nationally has been by state. So for Virginia, we're a storage facility, and we were able to distribute to ourselves based on the rules and the way it was set up. In West Virginia, our hospitals went to a Martinsburg depot where they received their shipments from Martinsburg because it was done at the state level, and then it was distributed. So we couldn't distribute from Winchester Medical Center to our West Virginia hospitals. We had to use the West Virginia allocation process for that.
Well, let's take a quick break. When we come back, can we get into the weeds a little bit about the vaccines themselves and make sure people do still understand that just because people are getting vaccinated now, that doesn't mean they can throw their masks in the trash or stop washing their hands or doing any of the other things. Can we talk about that in the next segment?
Absolutely. Love to.
Okay, we're going to take a quick break. When we come back, we're going to continue our conversation with Dr. Jeff Feit. He is the Vice President of Population Health for Valley Health. We are pre-recording our conversation on the Zoom screen. Dr. Feit referenced it a minute ago. Snow is falling outside on this Wednesday afternoon. You, of course, are listening to it on a Friday, but we are going to be back in just a couple of minutes, no matter when you're hearing this.
Got a financial decision to make or a goal to reach, but you don't know where to start? You've come to the right place. Introducing Quick Money Chats with the Northern Shenandoah Valley Financial Education Program. Visit tinyurl.com/quickmoneychat to schedule a virtual chat with a staff member or trained volunteer. We won't tell you what to do, but we will give you the tools you need to choose wisely. And because Virginia Cooperative Extension is part of Virginia Tech and Virginia State, your land-grant universities, you can be sure that our information is credible and trustworthy. And you'll know that we aren't trying to sell you something. Maybe you want to improve your credit score, or reduce your banking overdraft fees, or even figure out if you can afford to buy that car. Sorting through tons of information on the internet can be overwhelming, and sometimes it can be hard to know who to trust. Schedule a quick money chat and get the information you need to take action. Go to tinyurl.com/quickmoneychat and get financial education personalized for you.
Welcome back to the Valley today. I am your host, Janet Michael. Happy Friday as you are listening to the show today. Hopefully you have dug yourself out of the snow. We are pre-recording on a Wednesday afternoon as it is falling from the sky. We are chatting today with Dr. Jeff Feit. He is the Vice President of Population Health for Valley Health. We are talking about vaccines, COVID-19 vaccines that Valley Health received earlier this week. And Dr. Feit, we talked in the first segment about the process that Valley Health has put in place to get at least your frontline workers vaccinated first. But let's talk about the vaccine itself for a little bit, because I remember our last conversation, they were still in development, they were still running trials, and you said that you would be over the moon if they had a vaccine came out that was 70% effective. And now we're looking at 94, 95%. That's got to make you feel even more confident about getting these vaccines into the arms of people.
Yeah, let's talk about what that number means and try to break that down a little bit for people. So here's how the study works. There's 22,600 and some odd people in each arm of the study. So one group of 22,600 gets the vaccine, and the same number of people get a placebo, a fake shot. Okay, 43,000 and change. 21,600, so it's 43,000 and change altogether. Then what they did was they waited, and they documented cases of COVID. If people came in and had symptoms, they would test them. If they were negative, okay, you have something else. If they were positive, you have COVID. Boom, check the box. Then when they got to X number of cases, and I think X was something like 300, they unblinded the study. And by unblinding the study, what it means is they finally got to see, of the people who got COVID, what percentage of those people got the vaccine versus got the placebo. So the idea is that when you unblind it, if equal numbers of people in each group got COVID, then it didn't work. And if more people of the people who got COVID were in the were in the placebo group, then they weren't protected, and the people on the vaccine side were. Make sense?
Yeah.
So what they found was that 10 times more people who got COVID were in the placebo group. I don't remember the exact numbers, but it was something like 280 to 20.
Wow.
It was remarkable. So that's where that 95 number math comes from. How quickly people get COVID is less to do with the vaccine and more to do with how much COVID they're exposed to, the communities they live in, the behaviors they have. But those things are the same on both sides, right? The community issues and the behavior issues, the masking, the distancing, that's the same in both groups.
And we're going to have that whether we have a vaccine or not. So yeah. It was real life testing in its core. That works.
And that's why you do a placebo group, right? You don't want to just say to people, here's a vaccine and let's see when you get COVID, because then you don't know what would have happened if you hadn't given them the vaccine. So the reason the studies are set up with a control group or a placebo group is because you're trying to compare two equal things. And the idea is to keep those populations as equal as you can, except for the one thing you're testing, which is the vaccine. So they took 21,600 people in each group, sent them out into the world. You have a vaccine, you have a placebo, and wow, you didn't get COVID. And wow, some of you did. So that's where that 95% comes from. It's remarkable effectiveness. From an effectiveness perspective, this is a remarkably effective vaccine based on the data we currently have. I have no reason to believe that it doesn't prevent coronavirus. I think it prevents it with astonishing effectiveness. Not 100%, but really good.
In this trial, were they getting 2 doses like how the vaccine has ultimately become, or was it done as a 1-dose thing?
2 doses, 21 days apart.
So what happens if I don't get the second dose? What if I come in and I get the first dose and 3 weeks, 4 weeks go by and I forget to come back? Is that going to impact my ability to be immune from COVID?
Yeah, I'm going to answer that question a little bit of a funny way because I think it reflects on a lot of the things we're going to talk about in the next 5 minutes. When you only have one data set in a new drug or a new vaccine, you want to be careful about what you say you know. You only know the thing that was tested. Everything else is conjecture. And some of it's good conjecture and some of it's less good conjecture. But so what I can tell you is if you get 2 shots 3 weeks apart, you have immunity that lasts several months that's very effective. Whether you need a booster shot, unknown, right? We're going to have to follow those people along and see what happens as they go forward in time. And that will inform whether or not, that'll inform our knowledge about when you might need a booster shot. But what we know is that those folks have lasting immunity. And they've looked back at the phase 1 and phase 2 folks who've now been 6 or 8 months out, and they're tracking their antibodies, and people in the background are doing that work. So to answer your question, I don't know. My guess is, based on what I know about immunology, is that you'd be likely to have your antibody levels fade over time, and the effectiveness of your vaccine would fade over time, and you'd be less protected. But the honest answer is I don't know.
And this particular vaccine, the one from Pfizer and the one that will probably be approved in the coming days from Moderna, they are what's called genetic vaccines. They are not like we typically think of from the flu vaccine that are created from a strain of the flu. Explain to me what an mRNA genetic vaccine is.
Yeah, I want to avoid the term genetic vaccine. I like mRNA vaccine, even though most people don't know what an mRNA is. So, because the reason I don't like genetic is because it has this sort of goofy science fiction-y thing where it's going to change your DNA. Yeah, it's not true. So history of vaccines in a nutshell. So the easy one to understand is the smallpox vaccine, right? One of the big early vaccines. They took a mild form of smallpox and injected it into you. You were able to defeat the mild form of smallpox, and therefore you got protection against the worst form of smallpox, right? They delivered a similar illness. And by fighting the similar illness, you were able to prevent the worst illness. And that's the mental model for most vaccines. Then what they were able to do is take viruses and actually kill them, like actually deliver dead virus. And that way you couldn't have any chance of getting sick from the virus or from the vaccine. But again, it still gave you immunity. The next evolution of that, and what we're doing with these mRNA vaccines, is instead of delivering the whole virus, the whole, even an inactivated or dead version of the whole virus, they're simply saying, wait a minute. When coronavirus invades your body, the first thing your body sees is a protein called a spike protein. What if we just show you the spike protein? What would you, if you get used to killing the spike protein, wouldn't that be enough, right? If your body knows what a spike protein looks like and you can get rid of that, isn't that enough to destroy the virus? That's the logic. And how are we going to get you spike protein? Well, we're going to convince your muscle cells in your arm to make it. We're going to convince your muscle cells in your arm to make the spike protein. So that's how it works.
And it's interesting. I saw a tweet, and I promise you I'm not getting all of my vaccine information from Twitter because I know just how dangerous and ridiculous that would be. But one of the gentlemen that I follow on Twitter is a former CDC director. So I thought, okay, he's got to have a little bit of clout. He had a really interesting way of explaining it. He said, think of it as an email that you send to your immune system, and it shows you what the virus looks like and instructions to kill it. And then like Snapchat, it disappears. But
that's right.
The work goes on, even though the message itself is gone.
That's a great way to say it. So it tells your body to make this protein, this spike protein, and then your body learns how to kill the spike protein. And once your body knows how to kill the spike protein, it doesn't need it anymore, so you just stop making it. And then when your body is represented with the spike protein, it says, "Oh, I know what that looks like."
And that's kind of the key, is knowing how long that's going to last, that it's going to recognize that protein in 10 years, 20 years from now.
That's right. And so, again, trying to be philosophical about this, when your kids get vaccinated, we don't blink at the idea that they get 5 shots to be immune from polio. So I think folks have said, well, am I going to have to get a shot every year? There's been a little bit of negativity around how long will it last and will there be boosters. It's kind of normal. We have very few vaccines that are one shot and go. Most of them need a booster at some point.
Wasn't the theory initially when this novel coronavirus came out was if we could have done that quarantine, if everybody could have just holed up in their houses for 14 to 21 days and not gone outside and come into contact with anybody else, it would have killed itself off because it wouldn't have been able to spread. This is kind of the same concept. If you get everybody vaccinated, in theory, you have killed it overall unless something new comes along.
So I think that's true, but a little easier said than done, right? So we've been trying to eradicate worldwide illnesses that we've had vaccines for decades. And the virus finds a place to hide somewhere where there's not a lot of people and where there's not a lot of money. And, this is what the Bill and Melinda Gates Foundation does so well, is goes into all parts of the world and tries to vaccinate people. We're trying to eradicate polio. We're trying to eradicate smallpox. We've eradicated smallpox, but we're trying to eradicate these diseases. But then all kinds of things happen between, areas of the world that don't have great healthcare delivery, areas of the world where you get cultural beliefs against vaccines, like, sometimes the United States. It's hard. It's hard to convince 6 billion people to do the right thing.
Well, and I understand that there is a percentage somewhere, I think it's somewhere in the 70% range. 70% of the US population needs to have this vaccination, both doses of this vaccine, in order for this herd immunity we keep hearing about to even have a chance. So you've got to get 70% of the population on board to take this vaccine for it to really make an impact and knock this coronavirus out of our society.
I want to parse that a little bit. So I think there's a difference between make an impact and knock it out of our society. First and foremost, I want everybody to take this vaccine. I think it's safe. I think it's effective. I can't wait for everybody to be vaccinated and be protected, for the healthcare workers to go to work less concerned about their own safety and their family safety, the nursing homes to no longer have to have outbreaks that have devastated nursing. There's a million reasons I want everybody to take this vaccine. So I want to be completely clear that my goal is to vaccinate everybody and to have everybody get the vaccine. And I don't want to leave any doubt that that's where my heart is. That said, if only 60% of the people in the community get the vaccine, that'll still make a big difference. It'll still reduce first of all, it'll depend which 60%, because this is an illness that tends to really prey on the elderly. And also because I don't want anybody to think, well, we're never going to get 75%, so I shouldn't get the vaccine. Everybody we vaccinate is a step in the right direction. And it's one, there's a lot of mental models. Forest fires are a good mental model, right? If there's nothing to burn, the fire burns out. And so that's true. We still find fire somewhere else, right? So putting out the fire here, even if, Loudoun County doesn't get such a great uptake, we're going to see it'll come back. And then people who are vaccinated will have protection. The other thing about herd immunity I think is important, that herd immunity idea has really gotten out into the ether, and it's a tough one. It's really hard to explain, and it's really hard to understand because it's got a couple of different meanings. On one hand, there's this meaning which is if on average everybody who gets the virus gives it to 2 people, and you vaccinate X number of people, so of the 2 people who would have gotten it from somebody, 1.7 of them are vaccinated. Then for each person that gets it, they'll give it to less than 1 person, which eventually causes it to burn out, right? So that's one logic. The other logic is the vaccine is only 95% effective, and I say only in quotes because 95 is great, but that still means that 1 out of every 20 vaccinated people could get the virus. So the other thing you're trying to do by having more people get vaccinated is you're trying to reduce my mom's risk as an 80-year-old of being a vaccinated person who gets sick because the guy who delivered the pizza didn't.
Yeah, you're basically taking the over-under like you would when you're betting on a football game by getting the vaccine, even at 95%.
Well, yeah. So the person who gets the vaccine is clearly improving their odds at not getting coronavirus. That's true. But as a society, the herd immunity thing is twofold. One is we're trying to drive the illness out of our community writ large. The other is even for the people who got the vaccine, their chances of that vaccine being truly successful, in other words, not just giving them antibodies, but them not getting the illness, is in some ways still dependent on how much virus is still in the community. So the more people, so even if we only got to 30% of people vaccinated, that would improve the odds for people who are vaccinated at not seeing the virus as often.
And I think it's important to point out because we've seen so many boxes of this vaccine being shipped all over the country in the last several days. And now we've seen it right here in our community, but it's still going to be a while before just regular old me can go to a Walgreens or a CVS or come to you and have you give me a vaccine for this. We still need to follow all the protocols. We can't start getting sloppy now and thinking, oh, I see the light at the end of the tunnel. I don't have to keep doing this anymore.
Yeah, that's exactly right. So two questions here. Let me get both of them. So on the question of when will this get out into the public, hopefully soon. My hope is that we can do healthcare workers this year. My hope is that by the time late spring rolls around, everybody who's wanted one of these is able to get them. There's a million things that have to get answered between now and then, from supply chain issues to cold storage issues to distribution issues to all those kinds of things. But I have no doubt that the team that's been working on this up to now, and with the transition of the administration, the new team that comes in, this will be priority one in getting this vaccine out and distributed. Partnerships between health systems and doctors' offices and pharmacies and health departments. We're all in this together. That's been the theme of this year, and that will continue into next year. Your other point, and it's probably a great way for us to start to bring closure here, is I've spent this week with the vaccine really reflecting on the year, not just the vaccine, but the year. People have said, do I really need to take the vaccine? Is it really worth it to take the vaccine? And I don't think you can answer the question, is it worth it to take the vaccine, without taking a moment to think about the whole thing. A year ago, none of us had ever heard of coronavirus. And now 300,000 Americans are dead. 300,000. I believe that's more than all the wars we've ever fought combined. 300,000 people are dead. We've missed birthdays and holidays and family gatherings. We have all been through it. The healthcare workers, the nurses, the techs, everybody that comes into that building across the street from me and works, the doctors, everybody every day putting themselves at risk because they have an obligation to take care of the community, and they have served brilliantly and heroically throughout that time, taking personal risk. Everybody's done the right thing. Many people have worn masks. We've distanced. We've worked hard. And now we have an end in sight. We have a solution that's starting to come across the horizon. Now is not the time to take your foot off the pedal. Please be careful over the holidays. Don't gather with people that you don't normally live with. Wear your masks. Distance. I really am afraid of seeing a doubling of the cases this winter before we start to get to the finish line. And so please do the right stuff. Please keep wearing your mask. Please keep distancing, even once you get the vaccine, until we start to really see this come down in the community, and until we really start to see data saying that it's saying that people who have been vaccinated can't spread the illness. We hope to get that data, but we don't have it yet. So for now, I would say wear your mask, distance, do the right thing, and help us get over the hump, because the next couple of weeks are going to be hard.
So can I make the official invite to have you back on in mid to late January, and we'll pick this conversation up then and see where we are?
Absolutely. Happy to do it.
We are going to wrap up our conversation today with Dr. Jeff Feit. He is Vice President of Population Health with Valley Health. Dr. Feit, thank you. And I swear I wasn't joking. When it is my turn in line for the vaccine, I want you to be the one to give it to me. We'll do it on Facebook Live and everything. How about that?
I trained yesterday to be a vaccinator, so I'm happy to do it.
I hope you get out. Have a great weekend. I will have a brand new episode of The Valley Today ready to go for you on Monday. We are talking with Sari Karp from Sustainability Matters. Meet me back here just a few minutes after noon, and we can listen to that show together.